Hello and Namaskar. My name is Dr. Shuchin Bajaj. I am the founder director of Ujala Cygnus Group of Hospitals, and it is truly a pleasure to be here at the FE Healthcare Summit and Awards. I think these days the maximum questions that we get asked is how do you make sure that the rural population and communities get the same level of access to healthcare as the urban communities, because in urban India we have the best of the best, and I think better hospitals than anywhere else in the world at a fraction of the cost. But unfortunately, as soon as we step out even 50 kilometers away from the big city, people have no access to high quality healthcare, and even for emergency critical diseases like heart attacks, they have to travel 4 or 5 hours to access the nearest cath lab. I think the government and policymakers really need to make sure that we are incentivizing hospitals and doctors to go into the aspirational districts, to go into the small towns and offer services where they are needed. Unfortunately, more than 75% of Indian doctors are centered in the big cities and the state capitals and not going to the tier 2 and tier 3 towns. So if we can incentivize them to go to the small towns, if we can incentivize people to set up hospitals there, if we can give them some tax breaks or some subsidies on medical equipment, that would be wonderful. Also, we need to incentivize people to make in India and make sure that the medical equipment and the computer systems and the digital systems that we are using to deliver healthcare is made in India locally, so that it is affordable and accessible to the most deprived of communities that we have. Thank you very much once again for having me, and really looking forward to seeing you at the next summit.